As a dedicated parent of a teenage child with functional neurological disorder, short for FND, you have probably Googled every single doctor on the planet, not just in your state, but on the planet, only to find out, well, we don't treat it here, or there's a wait list for over 2 years. Well, you have to go through all of these things, and we don't do that here. So the question is, why is it so hard to find a darn specialist for your teen's FND? Let's talk about it, because it is not your fault, and you don't need to stay up all night, one more night, Googling what provider is out there to help, because there is a solution right here, right now. So let's dive in. Hi, I'm Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy, which is an online group coaching program to help teens with FND and their parents just like you to get their lives back. So there are 4 things that I want to talk about why it is so hard for every single family with teens with FND to find a provider that is specialized in, because there's a reason for it. And like I said, it is not your fault. But I'm going to walk you through that. So here's a harsh truth, number 1. The first thing is FND is misunderstood in the medical world. It is still treated like a mystery, or worse, dismissed as a psychological. And I don't even know how many times I talk to the parents and the teens who are dismissed as FND equals psychological. Oh, it's just a stress. Oh, it's just an anxiety. Oh, it is just a trauma. You need to find a trauma that doesn't exist. And the family is thrown down into this rabbit hole of seeing one therapist after another and walking out thinking, oh my gosh, we are doing everything that the doctor is telling us, but it's not helping. Well, guess what? Because the medical world does not understand what FND is, which leads to the second thing of, when I talk about the medical world, I have to talk about insurance. FND is not friends with insurance. So here is the deal. Unlike cancer or stroke or heart disease or things like that, FND is not considered as a medically necessary thing, because they're still thinking it's one or the other. If it's real, then we have a treatment, but we can't find anything on the scan or test, then it's not real. Hence, therefore, it is psychological, right? So if that medical world is understanding FND as such, certainly that means the insurance is understanding the same way. Therefore, the insurance as a company have no benefit in reimbursing for the treatment. That doesn't even considered necessary. And it goes beyond the FND. The insurance doesn't really cover what's actually necessary, especially for FND, which I can talk about more, like coaching, practicing regulation strategies, or long-term care. And this is where I run into a problem one after another, working in the hospital setting where I couldn't get the care that I needed to provide for my patients. So I didn't get the care that I needed to help my patients because neither hospital or insurance company cared about it. And then they're like, oh no, this is just a psychological, and you are a psychologist in a hospital setting, so you don't need to see a patient for a therapy. You just need to outsource and send those patients outside of the hospital for counseling sessions, because insurance doesn't cover for your service anyway. So that is the dilemma that I have faced for years and years and years, which is, again, definitely related to why I created my own program, Teen FND Academy, which, by the way, if you're enjoying this video and other videos on my channel, please hit subscribe and like button, and then share this video with everyone on the planet. Your pets, your neighbor, whoever it is that has an account or interest in caring for you and your child, because the more awareness we have, guess what? The more support we can get. All right. So moving on. So because of the medical world's understanding of FND and then the insurance company, they don't help. The end result is hospitals do not invest in FND programs. I guarantee you, and I'm not lying, almost every week, if not more often, I hear from the parents from all over the world at this point saying, the town we live in had this program for FND, but they closed down. Oh, we had this hospital that had FND program, whether it was an inpatient or outpatient, but they don't have that anymore. They stopped funding. Well, guess what? Because the hospitals are not getting paid by insurance for the care that you guys, teens with FND, need. Therefore, hospitals go under a huge pressure of maintaining the other revenue opportunity, meaning other treatments that insurance companies are willing to reimburse. Anything that can be covered by insurance is usually surgery, medication. So if FND does not require either, there is no surgery or medication that cures FND, unfortunately. Therefore, if the insurance doesn't pay, then hospital does not need to develop or invest in those programs, which falls under FND. Now, realistically speaking, right, a lot of teens with FND and adults for that matter, they go to ER God knows how many times, and it is actually costing the hospital a lot of money, and then state and then at the federal level, depending on what kind of insurance coverage you have. However, as long as the hospital can be reimbursed for those visits in ER, which they can bill for their service, then that is more quote unquote profitable than having an FND program run that doesn't get paid by insurance. So it sounds very wonky and then logically it does not make sense. However, that is how the hospital runs. Now, the harsh truth number 4 is most providers actually never learn about FND in training because FND is considered either mysterious or worse, psychological. So in the medical field, other providers who are treating other medical conditions or neurological conditions, they know a lot more about migraines, headaches, sleep problems, or like epilepsy. Not that there is any better or worse, but it's just naturally FND is considered a mysterious, and because of the historical stigma that FND is the same thing as convergent disorder, which is a pure mental health disorder, which is anxiety, stress, or trauma, whatever, FND doesn't necessarily attract a lot of medical providers to be interested in. And so this is all like a trickling down. Therefore, for those who are invested and interested in treating FND, what happens? They get overwhelmed and they get overbooked and then they burnt out. So they leave the practice out of the hospital or medical setting, and there are fewer and fewer and fewer providers available. So that is the problems that we're facing. The other part is, again, this is more a systemic issue. The FND is not suited for the system because FND needs a biopsychosocial approach. Like I talk about 1,000 times on this channel, biological, psychological, and social. And if you're wondering, what is that? Watch tons of videos that I talk about what biopsychosocial model is for FND. But the problem is the system, the conventional medical model, is built for either or. It's either biological or it's a psychosocial. If it's a medical or mental health, and FN needs both, like coaching, skill building, and family involvement. However, the system is set up either medical or psychological. If it's a medical, then it's a medication or procedure or surgery. If none of these things are option for FND, then automatically they get kicked into psychotherapy. That's why a lot of people get confused. Wait, my body is paralyzed and I am having these seizures, and why do I need to go see a psychotherapist for that? That is such a slap in the face because that's how the system is set up, especially in the conventional medical model. And providers also want to help. And just to be clear, I worked in the hospital setting for many, many years, and a massive, massive respect. Nothing but respect and love and care for all the colleagues that I worked with. However, most providers are overworked and they don't have a training for FND or the structure to help, right? That's why it's not really their fault either, right? But there is no roadmap for them, even if they want to help. That's why when I worked as a psychologist in a hospital setting, I was very limited on seeing patient, either the number or the time or the minutes that I could see, because otherwise I am not quote unquote productive, like I was a salesperson to the hospital. So I really got sick and tired of that. And therefore, I am so happy that I am out of the system, even though I have a massive, massive respect for my colleagues because they love what they do. But I have never heard of these providers, at least that I know, truly happy working within the hospital setting, including the administrative part and hospital, red tapes and things like that, right? And again, I'm not looking for a perfect scenario. Of course, everybody has some sort of like unhappy things to talk about and think about, which is fine. However, when it comes to FND, I will say specifically the insurance company and hospital setting are not really good friends with FND. Therefore, you are in this conundrum of wanting to get the help, but you can't find the provider who can help your child, let alone you. And this is exactly why I created my program, Teen FND Academy, which is a step-by-step proven methodology to help teens and parents basically go beyond FND and then be done with it and not just cope with it. This is not about emotional support. Just because I'm a psychologist doesn't necessarily mean it's all about psychological support. Of course, there's emotional support in the community. However, they are working like really, really hard every single day because there's a structured step-by-step practical strategies and skills. Not only you, but your teen also need to practice to get their life back. And the thing is, I do not believe in waiting for your teen to get better, because every day you wait, every day you're kicking the can, every day you're delaying the decision to get the help from the actual expert, then you're basically wasting and costing not just the money, but the time. The time is something you or your child cannot get back once it passes. So if you just found my YouTube channel, welcome to the club that you didn't sign up for. And here is the answer and hope that you can actually get better. If you have been told by doctor after doctor saying, oh, FND is just psychological, oh, FND is not curable, you have to kind of live with it, and you just don't do anything because there's nothing you can do, those are all incorrect. I have seen one too many times the teens got better, from wheelchair bound to fully running marathon, pretty much. So it is a structured recovery plan that I offer in my program. And if you want to know more about it, and if you want to join the program, click the link below and apply for the program and see if you qualify. Because I am very selective of who I want to work with and who I can work with, so I can help you if you are a good fit for my program or not. If not, my team can do that. All right. So thank you so much for watching this video, and do not lose hope. Hope is absolutely there, but you have to find the right path for your child to get better. And unfortunately, conventional medical model is not necessarily the answer. But if you want to keep learning what FND is, because you just got diagnosis of FND and you're like, you don't even know where to begin, then keep watching my videos on my channel and educate yourself. That is the best thing and then the first thing that you can do for your child. I'll see you in the next video.